Well, as we all wait for a COVID-19 vaccine to roll out, a Milwaukee epidemiologist studied the racial disparities of those who have contracted the virus.
So she found African Americans were 5 times more likely to contract coronavirus than any other race. Our Julia Fellow shares why researchers believe they found the root cause of this.
Dr. Sylvia Munoz-Price studied every COVID-19 patient who walked into Froedtert Health hospitals. She believes structural racism, including fair housing and health opportunities, is the core cause of many issues.
So if they live in a poor neighborhood, they have poor outcomes. It is not the race itself. Many variables that are associated with structural racism, race, poverty, and the neighborhood where people live kind of goes together.
The CDC estimates COVID-19 hospitalization rates are 4.5 times higher among Black, Hispanic, and Native American populations.
But the reason why we were seeing more ICU patients that were African Americans is because there were more African Americans testing positive.
Dr. Munoz-Price says people at most risk live in crowded, multi-generational households, are likely essential workers, and use public transportation.
I think this is a wake-up call to the high degree of segregation and inequalities in our city having major impact in the outcomes of the pandemic.
I reached out to leaders with the Milwaukee Health Department to see if they are going to follow the CDC's Social Vulnerability Index to determine which neighborhoods in Milwaukee will get the vaccine first once it rolls out. They tell me they are not releasing specific plans just yet. In Milwaukee, Julia Fellow, TMJ4 News.
All right, Julia, thank you very much. And if you would like to read the epidemiologist's full research on race and COVID-19, you can always head to tmj4.com and click on the link for this story.